saw this patient who had basically a locked knee. She couldn't flex it. And so why is that? It's probably because she has a problem with the meniscus. The meniscus is fibrocartilage that sits in between the bones. You have one on the outside of the knee, the lateral meniscus. You have one on the inside of the knee, the medial meniscus. They're both C-shaped. There's really good blood supply to the periphery of the meniscus, to the outside. So this is why some meniscus tears can heal. But if you have tears that are closer to the center, they can't. And there's different types of tears. If you're like an older person and you just have like wear and tear, you can just have like fraying. That's a degenerative meniscus tear. You can get like a bird beak tear, which kind of wraps around like that, which this lady may have had. And basically that can like flip in and out of the joint, and that can cause a problem. You can get a radial tear, which just kind of goes straight in. Again, no good blood supply, so it's probably not going to heal on its own. Worst case scenario for meniscus tears, you can get what's called a bucket handle. And that's where the tear kind of starts in the middle and it works its way all the way around. And if this thing moves or gets displaced, if you grab it like you would a pail of a bucket, it can flip over and it can basically sit in the joint. And then you can't, your knee is like stuck. You can't move it, right? And so you got to get that thing reduced and flip back as quickly as possible. Hopefully there's good blood supply and the surgeon can come in and stitch it together. If you had a tear that was just kind of like a horizontal tear, more towards the periphery, near the blood vessels, we might be able to fix that without surgery. You could put PRP in there or stem cell and rehab it and potentially have a good outcome. So we had this patient, couldn't move her knee, felt like it was stuck, felt the pop, all of a sudden she could move it again. She probably has some sort of flap or bucket handle meniscal tear. We're gonna get an MRI and try and figure it out. Thank you for coming to my TED Talk.